Hi, welcome to the December edition of The Pulse. I'm Gary Paxson, and with me today is Mandy Langston. Mandy is pharmacy supervisor at Stone County Medical Center and also does pharmacy informatics for the entire health system. Mandy, it's a genuine pleasure to have you with us today.
Thank you. It's good to be here.
Great. So you have been on a journey for a couple of years, and the moral to that story is you've been a great advocate for the 340B program and a particular drug. And so recently you've been given an award, and I don't want to steal your thunder. Why don't you share that journey with us and what you've done for our community?
Okay. So in January of 2017, the drug Activase, which the generic is Alteplase, it's the drug used in acute ischemic stroke with the program Arkansas Saves through UAMS. So overnight, the price for our facility went up about 385%.
Wow.
So really quickly happened, didn't really know what was going on. I contacted several people immediately to see what happened. Our 340B vendor group, Paxson, and they said that they'd heard from about 30 other hospitals in the same time frame. This was January, February, and that their pricing had also changed. So did some digging, talked to the drug company Genentech, who owns the drug, and found out that that January of 1st, 2017, they had decided to designate the drug an orphan drug. So basically before that, so Activase has never actually been FDA approved as an orphan drug. Oh. An orphan drug is a drug that has to be used to treat a rare disease, which is supposed to be less than 200,000 people in the United States per year. And never been actually approved for that, but there was a couple of physicians and a pharmacist that had gone for a disease designation for the use of Activase in these rare diseases. So it was on a list on a website with HRSA, who facilitates the 340B program. And as a decision that the company made to kind of save money, or it was along with other drugs at the same time. Most of those were cancer drugs, because most cancer drugs and chemotherapy are actually orphan drugs.
Sure.
So Genentech owns a lot of those. So it's kind of on a list that came out in January of 2017 and said this is now considered an orphan drug. And what that means for critical access hospitals is that we do not get the 340B discount on orphan drugs.
Okay.
So we actually were a part of the program from 2010 with Obamacare, is what added critical access hospitals to the 340B discount drug program.
Okay.
So with that, there was a last minute change in that language on that bill that said that these programs can come on as 340B, but they can't get discounts on orphan drugs. So that's kind of what happened, and it happened very quickly. So for about 6 months, I contacted several agencies, the FDA. We had conference calls with the FDA, and they agreed with me, but they thought that HRSA needed to be the one to kind of facilitate this. Yeah. And then HRSA decided that the FDA needed to, because they're the ones that make the designations.
Sure.
I ended up talking to every hospital in Arkansas, the critical access hospitals, and just heard a lot of stories from different pharmacists that this was really going to affect them. Like most of them, the ones that are standalone, really small facilities, struggling to stay open. And they said some of them had for up to 40% of their budget is this one drug.
Wow. So
they didn't know if they could be a part of the program.
Sure.
They were going to have to struggle to even keep the drug in stock.
Yeah.
So basically, this whole time I was also talking to Arkansas Saves, kind of behind the scenes, and ended up not getting a lot done, talked to several politicians and things like that, and didn't really go anywhere. So contacted a reporter at the administration at White River, was actually on board with that. So appreciate that. And she came from Washington, D.C. and came and interviewed me, and it ended up being on NPR radio. All things considered, there's a story about it, and they followed one of our patients that had gotten the drug and talked about how this has affected these hospitals all across the United States, and especially being in Arkansas, where this in a drug belt. that it could really cause, lives to be lost if
Absolutely.
with this decision. And this drug has been out for, it's been FDA approved since, for 30 years now. So
Oh my.
since 1989, and it still is a brand name drug. So there's no generic, there's no alternative for stroke.
Wow.
And so basically this is, where we're at, the situation.
Oh my.
So fast forward 2 years, and at the stroke conference this last October, Renee Joyner, she's the director of the UAMS Arkansas SAFES program.
Mm-hmm.
They'd never really done this award before, and they decided to present it to me and honor me for my advocacy, and it was really, really an honor.
Yeah, and well deserved. What a great testament to, a lot of times we think our voices may be too small and we're in a rural area and nobody will listen, but
Right.
gosh, the tenacity just to know this is important. This affects those that we care about and that we serve. Very, very proud of you for what you've done over the last couple of years. We thank you very much
Appreciate it.
for doing that and for making a huge difference to everyone that we
Appreciate that.
serve. So really appreciate it, Mandy. Glad to have you on the team. We're proud of you and we're happy to have you with us.
Thank you.
You bet. Our employees of the month for the month of December at Stone County, Wayne Jackson from Patient Registration's been with us for 2 years, was selected for his work ethic and teamwork. Wayne, really appreciate you. Congratulations on being chosen and for the great example you're setting for your colleagues. And at White River, Angela Sutherland from the biller at the diagnostic clinic has been with us for 12 years and was selected for her representing the standard of positive demeanor. Angela, we thank you so much for that. Exhibiting that positive demeanor makes such a big difference to your colleagues and to those customers that come to visit us. Thank you both. Congratulations to both of you for being recognized for such a distinguished award. In the area of news, we're going to be having a retirement celebration for Dr. Robert Baker on December 6th from 3 to 4 p.m. at the Josephine Ray Rogers Conference Center at White River Medical Center. Come out and celebrate with us as we wish Dr. Baker well in his retirement and well deserved over many years of service. We want to congratulate our internal medicine residency program at White River Medical Center for receiving an honorarium recently. And it's not so much the amount of the honorarium, but just the fact that we were one of 19 hospitals across the country that were selected for this honor to encourage the importance of internal medicine residency programs across hospitals. We're proud of everyone who's involved and the ability to be able to apply and receive this grant. Congratulations to you. Well deserved. We also want to congratulate Christy Wyatt. Christy is the laboratory director at White River Medical Center and also responsible for some clinic operations. And Christy was recently nominated as the 2019 Distinguished Alumni Award from the ASU College of Nursing and Health Professions. Christy, congratulations. We're very proud of you. You've done a great job for so many years for us. And this is a great recognition of the service that you provide for our organization, and we're very proud of you and congratulate you on that. We just want to say happy holidays to everyone as we enter this season and think of Christmas coming and New Year's. We will really want to wish all of you a great holiday season. We thank you for the dedication that you give to our organization, our communities, and hope that you enjoy that season. And we look forward to talking with you more in 2020 and visiting with you. We will see you next time.